Okay, so my presentation is going to be on hydrotherapy. This is a modality that I decided to present on, and I will be speaking about two different types of hydrotherapy. One would be thermal therapy and cryotherapy, which would be cold whirlpool and warm whirlpool. So, a little introduction to hydrotherapy. It is a therapeutic modality that is a subcategory of two thermal modalities. Thermal therapy falls under heat, which would be the warm whirlpool, and cryotherapy would be the cold whirlpool. Hydrotherapy is a modality that uses water as a medium in order to transfer the energy from the water into the human body and allow it to adapt and perform the physiological changes that must go on. And of course, there's going to be different benefits and effects with cold and with warm. So, hydrotherapy is a modality that's been used for a long time. Ancient cultures used to use this, such as India, China, and Egypt. It's been used for thousands of years, and it is something that the Eastern Society recently adapted and started studying and doing research on. And as I mentioned earlier, the two types of hydrotherapy would be cold whirlpool and warm whirlpool. So how is hydrotherapy used? Hydrotherapy is used via cold whirlpool or warm whirlpool, and you have the patient or the individual submerge either their extremities or their full body into the water. There are different benefits that come with warm and cold whirlpools, and the benefits that you're trying to achieve depend on the clinician and what it is that the clinician is trying to achieve with the individual that is receiving the treatment. So cold whirlpool. The main benefit of cryotherapy is that it decreases tissue temperature. Once the body's temperature decreases, nerve excitability decreases. So the nerves that are most distal tend to slow down in the terms of firing rate. This decrease in firing rate results in pain modulation, so decrease of pain sensation. Cold whirlpool can be used to help patients reduce their perception of fatigue. Cold exposure increases opioid tone and metabolic rate. So cold water immersion has been found to be beneficial in treating delayed onset muscle soreness, otherwise known as DOMS. A study found that cold water immersion helps with improvement of decreased range of motion and an individual's perception of pain. So the effects of cold include decreased local temperature, vasoconstriction of arterioles and capillaries. So that just means that the arterioles and capillaries constrict and they become smaller in radius. Decreased blood flow, decreased formation of edema, decreased nerve conduction velocity, decreased muscle excitability, decreased delivery of leukocytes, decreased delivery of phagocytes, and decreased lymphatic and venous drainage. So indications of cryotherapy. So these are reasons why you would want to use cryotherapy or cold whirlpool. Acute subacute inflammation, acute pain, chronic pain, acute swelling, myofascial triggers, muscle guarding, muscle spasms, acute contusions, tenosynovitis, tendinitis, and delayed onset muscle soreness. Reasons why you would not want to use cryotherapy or the cold whirlpool would be a decrease in circulation, peripheral vascular disease, hypersensitivity to cold, skin anesthesia, open wounds, and infections. So now we're going to talk about thermal therapy or the warm whirlpool. So the main benefit that comes with the thermal therapy is to increase tissue temperature. It also increases nutrition to damaged cells. It helps reduce edema. It is estimated that treatment time should last approximately about 20 minutes. Warm water immersion is more beneficial than no treatment in improving range of motion affected by DOMS. So a study that I looked into stated that cryotherapy in terms of whirlpools is more efficient than thermal therapy. However, thermal therapy proved to be more efficient than an individual who receives no treatment at all. And this study was conducted with seeing the difference in perception of pain and fatigue in individuals with DOMS. Another good thing about the thermal therapy is that it's very beneficial for individuals post-surgery rehabilitation, as it increases systemic blood flow and it increases mobilization of the affected body part. Thermal therapy also has a tendency to increase elasticity and decrease viscosity of connective tissue. So the effects of heat include increased local superficial temperature, increased local metabolism, vasodilation of arterioles and capillaries. So how I mentioned vasoconstriction for the cold, vasodilation, so that just means that the radius of the arterioles and capillaries become wider. Increased blood flow, increased leukocytes, increased phagocytes, increased cell permeability, increased lymphatic and venous drainage, increased elasticity of connective tissue, and decreased muscle spasms. So indications of hydrotherapy, yes. So reasons why you would want to use a warm whirlpool or thermal therapy. Subacute and chronic inflammatory conditions, subacute chronic pain, subacute edema removal, decreased range of motion, myofascial triggers, muscle guarding, muscle spasm, subacute contusions, and or infections. Reasons why you would not want to use thermal therapy include acute musculoskeletal conditions, impaired circulations, peripheral vascular disease, skin anesthesia, and or open wounds or skin conditions. So the protocol for cryotherapy or the cold whirlpool are that the temperature range for the water should be between 50 to 60 degrees Fahrenheit for extremities. It is recommended for the temperature to be a little bit higher if an individual is going to go into full body immersion, as it could affect the internal organs compared to an extremity that there are no internal organs nearby, so it can probably withstand a little bit colder temperature. When an individual is using cold water immersion, they should be in the whirlpool for a minimum of 15 minutes and no more than 20 minutes. After about 15 minutes, the individual will start to experience a reaction called Huntington's response, which is a vasodilation reflex. The brain believes that the extremity is quote unquote dying, so it initiates vasodilation to allow blood flow to return to the body area that is being affected by the cold. Frostbite occurs to the body if the tissue falls below 32 degrees Fahrenheit, so that's why it's important to maintain the water temperatures at those levels and to not be inside the whirlpool, the cold whirlpool, for that long. An athlete should always shower before beginning the treatment. So now for the thermal therapy protocol. So a warm whirlpool water temperature has different ranges depending on the part that is being used to treat. So a hand or an arm should be anywhere from 98 to 110 degrees Fahrenheit. A leg should be 98 to 104 degrees Fahrenheit. And full body immersion should be 98 to 102 degrees Fahrenheit. And the reason for these are the same as the reason for the cold whirlpool, as the full body immersion will be affected by the internal organs of the body if one goes into full body immersion. So it's important to pay attention to what the treatment's going to be and if either it's going to be an extremity or a full body submersion that's going to happen. And paying attention to that will prevent possible damage to an individual. Treatment should be approximately 20 minutes, and as same as the cold whirlpool, an athlete should shower before beginning treatment. In conclusion, so based on literature and research I read, it is more beneficial for an individual who's experiencing DOMS to experience or experiment with the cold whirlpool, as there was more benefits seen with cold water exposure. Now, this is not saying that thermal therapy or warm water exposure is not beneficial, but like I mentioned earlier, it did show that warm water exposure is more beneficial for individuals than an individual who does not receive any sort of treatment with thermal therapy. So if they just try to recover on their own, perception of fatigue is going to be slightly higher than an individual who goes into a warm whirlpool. and the differences are going to be a little bit more drastic for an individual who goes into a warm whirlpool, a cold whirlpool, as they will likely see better results. Another conclusion that I saw also from research I read is that warm water submersion for post-surgery individuals is very beneficial. An example that was made was for individuals who went through ACL injuries and ACL surgery repairs, as they come out with very limited range of motion, and a warm whirlpool will help them promote a better range of motion of the knee extension and knee flexion. And these are my references.